What's up, guys? Quinn Hennick here, Doctor of Physical Therapy of Clinical Athlete and Juggernaut Training Systems. We're here with Squat School number 3. We're talking about hip structure and how it relates to the squat. And so you hear a lot of times on the internet, videos, blogs, various things where everybody should strive for a certain squat position, as in there's this optimal position that should fit everyone, where everyone's in this cookie cutter approach where it's either toes forward or it's narrow, and that's what we should all strive for. And if you don't have that position, you have to do a bunch of drills and mobilities, drills and stretches and all these things to try to attain some type of gold standard. So what is more along the lines of truth and evidence is that everybody has to squat a little bit differently based on the structure of their hip, based on the limb lengths that they have, and various other anatomical differences. And that's what we're going to demonstrate here. So we've got two different athletes, Colin Burns, Courtney Batchelor, two snatch American record holders. They know how to squat, but what you're going to see is they both squat very differently. So Courtney, I want you to hit a couple air squats as you typically would. So attain whatever squat position you would. And so you can see Courtney prefers a toes out position, a little bit wider. And this is something that a lot of people would say maybe we would want to correct for some reason, that putting your toes out would be injurious or unsafe or less optimal for performance. But really, if you look, what's happening here is her knees track right over the middle of her feet. Her joints are stacked, the hip, knees, and ankles just hinge naturally. You know, it's bend and straighten. But that is her position. That's what she prefers. That's where she feels strongest. That's where her hips feel the most open. Colin, now, as far as our guidelines and general rules of thumb, hips, knees, and ankles hinging naturally, the knees tracking generally over the middle of the foot, is the same. You know, he's meeting those guidelines, but you can see his position is much different. He's more narrow relative to his body height than Courtney. His toes are much straighter. Courtney, do me a favor and try to squat like Colin. Try to mimic that. Do that again. Yeah, it looks super awkward, right? How does that feel?
Terrible.
Go a little bit wider with your feet, but still go toes forward. Right there.
Good?
Yeah.
Even worse.
Okay.
Yeah.
So would you say that it feels like to you that that stance is not optimal, even though that's kind of what we hear, you know, toes forward, go back to where you were just so people can have a visual and squat from there. Good. And then Colin, try to mimic Courtney's stance. So for you, it's going to be a little bit wider, toes way out, yeah. Drink your soup. Do that again. Now, what does that feel like to you?
It feels like I have no balance.
No balance, and so it feels weaker. Now, Colin, and so what we're going to do is show you guys why this is so, why people squat differently, and test some simple drills and visuals so you guys can see as far as hip structure dictating these things. Now, Colin is one of those guys where I think he could squat from a mobility standpoint in any position he wanted. For him, it's going to be about what feels the strongest. For Courtney, it's going to be respecting anatomy a little bit more. So Courtney, lay on your back here on the table. And as coaches, assessing joints is not necessarily something that you have to do or maybe even want to do. We can kind of skip to the drills that we'll do following this. And for you guys, for any of the clinicians in the room or on the internet watching this, this will be familiar as just general hip range of motion testing. And so I'm going to take Courtney's hip, and from a straight mobility standpoint, passive range of motion is really where it's at, right? Can the joints attain the range of motion that we're trying to load? And so when I take Courtney into just straight hip flexion, where the foot is in line with the knee, I'm pushing the knee straight, maybe towards kind of the inside of her left shoulder here, I hit kind of a block, right? And it's just below parallel. What does that feel like to you?
It's just super uncomfortable.
It's just a little uncomfortable, right? And so likely she's not going to squat in this position if she feels that. Now I'll kind of move the hip joint around. I'm not pressing terribly hard, but all of a sudden I kind of feel like it falls into a cleft. It feels much more open when she's wider. So does that feel more comfortable to you out here? And if you guys remember how she squatted, this is very similar to the way that she squats, so it makes perfect sense. This would mimic a more narrow stance. It jams up a little bit. I can feel that. She can feel it. If we come out a little wider, then she has more space. And that has everything to do That has very, I'll back up, that has very little to do with her lack of mobility or something wrong with her hips, and very much more to do with her anatomy and what's individual to her. And we can take that assessment a little further and look at rotation. And so if I rotate the hip this way, this would be external hip rotation. The foot is going in, but the hip is rotating out. And if this is 0 degrees, she's pretty darn close to about 90, I would say maybe 80 degrees of external rotation, which is plenty for a squat. It's a surplus of external rotation. When we go into internal rotation, she's a little bit more limited. I hit a bony block, and that's just the way that she's structured. So if this is 0, maybe we're getting 10, 15 degrees there. What does that feel like? Little janky? Yeah, so and it makes perfect sense. She prefers external rotation, which is her toes out position, and she prefers to be a little wider because that's where her hip socket has the most space. Now if we take Colin, get out of here. Go play in traffic. If you remember, his squat was much more toes forward. It was a little bit more narrow relative to his body. So if I assess the hip this way, again, same way, foot in line with knee, knee tracking pretty close or similar to a narrow squat. It's much more free in that position. This would be like his feet, 6 inches apart in the squat. And so it's not necessarily mimicking his exact stance, but just in general, I'm not feeling much of a block when I go there. And that's likely why he can squat a little bit more narrow. And if I, again, scour the hip joint a little bit, and there's a groove that I hit about right there that's much more narrow than Courtney's, whereas I took Courtney's knee way out to the side to get her greatest depth. And that actually takes Colin into a little bit more shallow of a position. His hip socket, or his hip actually comes back to me into extension. And so the deepest point of his hip is about right there. And that happens to be where he prefers to squat, shockingly enough. And if we look at rotation, so this is Colin's external hip rotation. So if this is 0 and this would be 90 degrees, he is maybe at 45, which is still plenty for a squat. I mean, who squats with their knees that far outside of their foot? So he's got enough external rotation, but you can see the difference between him and Courtney. And if we look at internal rotation of the hip, much more capacity than with Courtney's structure. You can see if this is hip internal rotation at 0, way out here to maybe 35, 40 degrees. Now, obviously, he's not going to squat like that, but what that allows him to do is squat a little bit more narrow, almost like he's sitting in between his feet with his toes straight. And there's a lot of variables that have to do with that. The angle of the femoral neck, where the hip sockets are oriented relative to the pelvis, the depth of the hip socket, none of that really matters. I don't have x-ray vision, I can't see that stuff. And so a quick little assessment will give me an idea. And so we can take that and use the next couple drills for athletes to figure out, and coaches to help their athletes figure out what bottom position is most optimal for them. So let's go into quadruped